welcome back to Doctor ThaliaRae, your source on YouTube for all things dentistry. First things first, subscribe below if you like what you see. Leave me a comment to let me know what you want me to talk about next, because that's great. Today's topic, we're talking about wisdom teeth. The purpose of this video is to answer the question, do I need to get my wisdom teeth removed? Having your wisdom teeth extracted can be anywhere from a really easy experience to very, very expensive, especially if you decide to go to sleep or be sedated. Most people are aware of what having your wisdom teeth removed involves. There are hundreds of videos on YouTube of people leaving their dentist's office nice and drugged up. The first YouTube video I saw of someone leaving the dentist after getting their teeth taken out was David at the dentist. Do you remember this guy? I had my wisdom teeth removed when I was 20. My dentist had made the recommendation to my parents that my wisdom teeth needed to be taken out. At the time, I was dating this guy in college that I was kind of crazy about, so I had a lot of concerns. Particularly, was I going to be super swollen when I first got off the plane, because after a summer of being apart, I wanted to look, amazing. Now, I don't mean to age myself, but I don't think YouTube was even around when I was 20. I called my boyfriend and I said, hey, am I going to die? He obviously thought that was a little bit much, but I didn't know. You guys probably don't know this, but I grew up in a super tiny town in South Dakota. Basically, we drove about 50 miles, and guess what? I survived. So, what are they? Wisdom teeth are considered extra teeth. Almost everyone is born with 28 teeth in their mouth. Anything beyond that is called a wisdom tooth. I have seen individuals who have no wisdom teeth whatsoever, and I've even seen patients who have as many as 10 wisdom teeth. That being said, the most common amount of wisdom teeth for people to have is 4. You have to think about it a little bit like this way, right? So most people have 5 fingers. If somebody is going to have an extra finger, which isn't common, that extra finger is probably going to be a little strange. It's the same with wisdom teeth. Because wisdom teeth aren't normal in size, shape, and behavior, they can cause a lot of problems with your other teeth. For example, if they're under the gums or the bone, they can be very difficult to clean, leading to recurrent infections. If your wisdom teeth stay below the bone and never erupt into your mouth, your body can react to your wisdom teeth kind of like having a splinter in your jaw and try to push the tooth out with fluid, forming something called a cyst. And if wisdom teeth are positioned the wrong way, the pressure from that tooth trying to come up out of your jaw can do damage to the adjacent teeth or the teeth directly in front of them. Whether or not to remove wisdom teeth is a bit of a controversy in the dental world. The good news is there are definitely some situations in which you should get your wisdom teeth removed. If you have a history of infection, pain, or cavities or decay in any of your wisdom teeth, then you should definitely get them removed. Another reason that your dentist might recommend that you have your wisdom teeth removed, even if they're not causing you pain, is simply because you're younger. The root of the wisdom tooth in a younger patient is less developed, which makes the tooth easier to remove. If the tooth is easier to remove, that means that there are less complications and less pain after the procedure. Another reason that a dentist would recommend wisdom teeth be removed when they're not actually in pain is called prophylactic. Basically, by having your wisdom teeth removed, you can avoid some of the complications that the research has shown will happen if you have the teeth extracted after the age of 25. In 2002, the American Association of Oral and Maxillofacial Surgery and the Oral and Maxillofacial Surgery Foundation published a paper in the Journal of Oral and Maxillofacial Surgery. I have a paper in the Journal of Oral and Maxillofacial Surgery. Kind of excited about it. This joint study was a 30-month clinical longitudinal trial. The paper proved that after the age of 25, your risk of having periodontitis or gum disease increases if you don't have your wisdom teeth removed. This data has been extrapolated in a lot of different ways. For example, periodontitis or gum infection, pericoronitis, can damage the gum tissue of the tooth in front of it. Also, once you finally decide to get those wisdom teeth removed at a later age, say 30 or 35, that increased cycle of periodontitis may lead to decreased bony fill in the fat or bone healing in the area where the tooth has been removed. So, are there reasons to take out a wisdom tooth that's not causing you pain? Definitely. Your dentist or your dental specialist who deals primarily with wisdom teeth has been trained to be able to tell if your wisdom teeth are going to cause you problems later in life, and may recommend, if your risk appears to be higher, that you have the teeth removed before they're even causing you discomfort. Since we're here, let's talk about what it means to have an impacted wisdom tooth. Dentist or dental specialist might tell you that your wisdom teeth are impacted. What does that mean? Impacted simply means that the tooth isn't completely up into your mouth like all of your other teeth. Wisdom teeth can be soft tissue impacted, which means they're stuck under the gums. Or they can be hard tissue impacted, which means they're stuck under the bone. The biggest thing that makes the difference in the difficulty level of extracting a wisdom tooth actually has more to do with the way the tooth is pointed in your mouth. For example, if the front of the tooth is pointing backwards, that's a little more challenging. For a dentist or a dental specialist skilled in removing wisdom teeth, it shouldn't make much of a difference. So under what situation should you definitely not have your wisdom teeth removed? It takes an actual examination and looking at your x-rays for me to be able to tell what's going on. I can't really say that you specifically should not have your wisdom teeth removed without getting in a ton of trouble. But generally speaking, if your wisdom teeth are fully erupted, all the way up in your mouth, appear to be regularly shaped, you can clean well in front of and behind those teeth with your floss, you might be one of those people who doesn't need to have their wisdom teeth removed until they're causing you a problem. Upper wisdom teeth are much easier to remove than bottom wisdom teeth, so if your upper wisdom tooth is fully erupted, causing no problems, you can probably wait a little longer. I'm guessing the real reason you clicked on this video is because you need to get your wisdom teeth taken out and you're a little uncomfortable by the fact that it's so incredibly expensive. Responsible adults have to spend $3,000 to $4,000 to have wisdom teeth removed in themselves or in their children. It's for that exact reason that I have started my practice, which centers solely around extracting wisdom teeth and cuts that price in half. Ka-ching! First things first, in most other countries, individuals do not go to sleep to have their wisdom teeth removed. The United States is kind of different. It's one of the only countries where dental specialists remove your wisdom teeth and put you to sleep at the same time. There are a lot of incentives to this for your dentist. They can bill for both putting you to sleep and taking out the teeth at the same time. Do you have to be put to sleep to have your wisdom teeth removed? No. Is it more comfortable to have your wisdom teeth taken out when you're asleep? Well, yeah, you don't remember a single thing that happened. As someone who's taken out thousands of teeth, including wisdom teeth, I can tell you that for impacted wisdom teeth, you probably will be more comfortable asleep. Does that mean you can't be awake? Definitely not. At one point in my career, I worked in a Medicare, Medicaid, urgent care clinic serving a very poor population. These patients would come in with severe pain in their wisdom teeth and they simply couldn't afford being put to sleep. And let me tell you that most of them handled having their wisdom teeth removed while they were awake just fine. If you have any history of dental anxiety or haven't had any significant dental work done in your life, having your wisdom teeth removed while you're awake can be traumatic. You use a blade and you cut your gums and move your gums out of the way. Use a dental handpiece to remove the bone, and there's a lot of pressure when I move the tooth out. So yeah, if you have more than 2 wisdom teeth that need to be extracted, going to sleep can be a much more pleasant experience for you than being awake. But yeah, you can decide to stay awake to have your wisdom teeth extracted, but in that situation, your dentist or dental specialist might only take out 1 or 2 of your wisdom teeth per appointment so that you have a chance to relax and so that you're not overwhelmed and have a horrible experience at the dentist. Any good dental provider is going to be focused on making sure you have good experiences in their office so that you continue to come back and take care of your smile for the rest of your life. So, thanks for watching the video. Leave your comments, let me know what you'd like me to talk about next or what you think of this video. I am here to help.